position, if you will, is that no one's at fault, right? No one's at fault in this equation. Patient's upset because she feels like she's being ignored with her symptoms or what have you, right? However, healthcare provider has nothing. So for example, with endometriosis, which I think is a really, really good analogy for this. Endometriosis, the only way to definitively diagnose this condition is what we lovingly refer to as the Where's Waldo approach to diagnosis, which means you have to have a surgery and the surgeon has to go in and look for the result of the disease growing somewhere in your body, take a sample of that growth and send it to pathology to have that confirmed, that it's endometrial-like tissue growing outside of the uterus. So when you have a patient who's coming in to her gynecologist office saying, I'm having these symptoms, I'm having these symptoms. And by the way, the symptoms of endometriosis aren't specific to endometriosis. They can be a lot of different things because the primary concern is pain with period. Okay, well, that could be a lot of different things, including just she has more painful periods, right? And so, the healthcare provider doesn't have a tool. They don't have anything in their tool belt that they can offer this patient to say, well, let's rule out these 3 things that could be causing those symptoms that would be problematic, like endometriosis or endometrial cancer or whatever it is, right? They don't have that tool for endometriosis. And so they are at a loss as well. And so what you end up with is what can become a distrustful or adversarial relationship, but it really there isn't anyone at fault. There's a lack of tools to enable meaningful engagement.
Yeah, and that makes sense.